Hi, I'm Gabriella Santamaria, and I am a pediatric nurse practitioner and an international board-certified lactation consultant here at Mary Center. I'm excited to share with you information regarding breastfeeding and what you can expect in the first 2 weeks after giving birth. So whether this is your first or your fifth child, the information is intended to help you prepare for your upcoming birth. Let's get started. In the first 2 weeks after birth, the focus will shift now on your recovery and feeding your baby. Any medical professional that you speak with will recommend you to breastfeed your child. Breastfeeding provides many benefits to both parent and baby. For any parent who has just delivered, breastfeeding assists in your body's overall recovery after delivery, as well as provide benefits to a parent's general health. The American Academy of Pediatrics report that parents who breastfeed have been shown to reduce the incidences of disease, including but not limited to ovarian cancer, breast cancer, type 2 diabetes, and gestational diabetes in subsequent pregnancies. For infants who receive breast milk has been shown to reduce the risk of suffering from a number of conditions, including but not limited to SIDS, acute otitis media, eczema. In the first 2 weeks after birth, there are two goals: to increase and maintain your milk production and have your baby reach and/or surpass his birth weight. Initially, after giving birth, you will think you are not producing any milk, and you would be correct. After a vaginal delivery, the first 3 days, you will produce colostrum, not milk. Colostrum is essential in providing antibodies to your baby. This will be in small amounts, but more than enough for your baby, as in the first 3 days, your baby's stomach is very small. These photos here show you the size of an infant's stomach the first week of life. Please notice in the first 3 days, your baby's stomach will be no bigger than a cherry. Therefore, expect frequent feeds every 2 hours. On days 3 to 5, expect to start feeling more milk production. By the end of the first week, you will feel further increases in your milk production. Overall, for all babies and parents, during the first 2 weeks after birth, expect regular feeds every 2 to 3 hours to ensure your baby is being fed enough. As your baby's stomach continues to grow, symptoms such as frequent stools will occur. It is expected from newborns to stool commonly after feeds or up to 6 to 8 times a day, along with wetting diapers as well. Sometimes infants may also become fussy due to gas pains. Your baby may also have episodes of spit ups as well. Such symptoms are very common in newborn infants. Please do not stop feeding your baby breast milk for such symptoms. Please speak to your pediatrician regarding such concerns, but understand that many of this is expected and common in newborn infants. As your baby grows, these symptoms improve. After a baby is born, pediatric visits are scheduled quite regularly during the first 2 weeks after birth. Plan to schedule an appointment with a pediatrician 1 to 2 days after your hospital discharge and a second appointment 7 to 10 days after your first pediatrician visit. Therefore, expect consistent contact with your pediatrician to ensure that you and your baby are well. Now that I have given you an idea of what to expect in the first 2 weeks after birth, I want to review with you some helpful tips to breastfeed. When I'm asked if breastfeeding is easy, I often respond, it can be. The key to a successful breastfeeding experience is a successful and beautiful latch. The desired breastfeeding latch consists of a wide gap of the baby's mouth, lips to be turned out, and a baby's belly touching your chest and upper abdomen. These are key in order to achieve a breastfeeding position that will be comfortable for you and for your baby. The key to achieving this latch is to follow these steps. 1. Bring your baby to your breast. 2. Lift your breast to position the nipple towards your baby's nose. 3. Wait for your baby to open their mouth wide. And then 4. Insert your nipple into their mouth. Please do not position your breast's nipple right in front of your baby's mouth. This will only cause for shallower latch that may be painful and uncomfortable for you and your baby. Remember, bring your baby to your breast. Lift your breast to position the nipple towards your baby's nose. Wait for the baby to open their mouth wide, and then insert your breast into their mouth. A baby's body position is also key in achieving a good latch. Make sure your baby's stomach is completely touching your chest and upper abdomen. Babies like to be breastfed on their stomachs. Make sure to position your baby that way in order to secure a good latch. Be sure to include partners and relatives too in your breastfeeding efforts. Have partners and family members practice skin-to-skin holds so newborns get used to being held so closely and prefer this hold when it is time for you to breastfeed. Remember, the body of any human being who gives birth is already prepared to produce milk. It is up to the baby and parent to work together to increase and maintain the body's natural production. In order to achieve and maintain a good production, do not plan to introduce any formula unless indicated by your child's pediatrician. Also, do not introduce pacifiers of any kind for at least the first 2 weeks to facilitate all breastfeeding efforts. Breastfeeding offers such a beautiful connection between parent and child. And be it your first child or fifth child, this is something that you too can experience. However, it's important for you to know that if you suffer or suspect that you may have the following issues, such as flat or inverted nipples, gestational diabetes, gestational hypertension, or will require a C-section, please speak to your medical provider for further guidance and preparation before you give birth. Please understand such conditions can affect your breastfeeding plans. This does not mean you can't breastfeed, but more than likely milk production may be delayed, and your doctor can speak to you more on what you may expect. If you choose to continue your child's care here at Mary's Center, we offer well-trained pediatric providers at each of our clinic sites and access to a breastfeeding lactation consultant, all of whom can assist you further in your breastfeeding goals. Additionally, expect to schedule a follow-up visit with either your midwife or OBGYN to ensure that your postpartum recovery is going well. It is our goal to make sure you feel supported not only throughout your pregnancy, but also during your postpartum journey. The team here at Mary's Center hopes you have found this video helpful and insightful. Feel free to go back and review any of the helpful information provided throughout this video. Should you have any more questions, please don't hesitate to speak to your medical provider for more information.